Hello everyone, my name is Alex, and today I'll be talking about the skeletal system along with rheumatoid arthritis. The skeletal system is the main support system for the body. It provides the body with its shape, protects internal organs such as the heart and lungs, allows the skeletal muscles a point of attachment to aid in the movement of the body. It is the main storage system for calcium and assists in blood calcium regulation. To elaborate on this, parathyroid hormone stimulates osteoclasts to break down bone and to release calcium into the blood. Meanwhile, calcitonin stimulates osteoblasts to create bone and remove calcium from the blood. The skeletal system also stores essential vitamins and minerals such as vitamin D and is the site for blood cell production within the bone marrow. A common disease affecting the skeletal system is rheumatoid arthritis, or RA. It is an autoimmune disease with no known cause. So the immune system mistakenly identifies a thin layer of tissue within the joint capsule, known as the synovial tissue, as an invader and begins to attack, causing inflammation and damage. The immune response creates antibodies against the joint tissue, further destroying it and creating further inflammation. The inflammation of the joint begins to deform the joint, bending the joint out of place. Bone loss within this joint is also very common, and it typically affects symmetrical joints. So let's say the interphalangeal joints of both hands. There's currently no cure for RA due to the autoimmune nature of the disease. Typically, joints go through cyclical periods of flare-ups and remission, where its symptoms will go from intense and painful to completely absent until joint damage reaches a point where remission is no longer happening. Medications for RA include NSAIDs, such as ibuprofen, to help with pain and inflammation, corticosteroids, which also help for inflammation and pain, but they also help slow the damage to the joints. Corticosteroids, however, have side effects that include obesity, diabetes, and bone degradation. So, corticosteroids are normally prescribed to relieve symptoms in the short term, and the goal is to wean the person off the steroids to prevent further damage. Disease-modifying antiemetic drugs, or DMARDs, are used to help slow the progression of the disease and to prevent any sort of damage done to the joints or other body tissues. Finally, biologics are used in conjunction with DMARDs to enhance the DMARD effectiveness. There are some surgeries that may be looked at as an option for treatment. These include total joint replacement, joint fusion, or synovectomy, where the affected synovial tissue is removed from the joint. Major body systems, like the cardiac and respiratory systems, can be damaged if RA is left untreated. Early onset heart disease is common because the arteries in and around the heart become stiff and more prone to blockage, along with inflammation of the pericardium, or the sac that surrounds the heart. Lung disease happens similarly to heart disease, where RA causes inflammation and scarring inside the lung tissues, causing shortness of breath. Obesity increases with RA because of the lack of mobility caused by RA. And individuals are less likely to move around, preventing pain, so a sedentary lifestyle may be adopted, leading to obesity. Osteoporosis, while not a direct complication of RA itself, but of the medications used in conjunction with RA, like corticosteroids mentioned earlier. Finally, an increase of lymphoma has been shown to be present with people with RA because of the impaired function of the lymph system due to the overactive immune response in the joint. Keeping the body moving is vital in keeping the body healthy no matter the circumstances. In the case of RA, though, moving the body can help alleviate symptoms and maintain joint health for longer. Physical and occupational therapists may suggest using some assistive devices if moving the joints are too painful. For instance, using a button hook to help button a shirt or pants may be used to help those who have limited function in their hands. Medical supply stores may also sell certain assistive devices or attachment that can help things like lack of grip. Similarly, modifying exercises to accommodate loss of joint mobility can help keep the person moving. Using forearms instead of hands to pick up objects, or using a stool to help bend over can help maintain joint health, muscle mass, and movement in the body, leading to more independent and higher quality of life. As with most diseases, exercise is something that can be done to help prevent further damage and help maintain quality of life for longer. It is imperative that we keep moving so that we can live long and healthy lives. Thank you.